Good morning. Thank you, Dr. Ramirez, for this invitation, this fantastic meeting. And I thought the impact of early ECMO support on survivors patients with hantavirus cardiopulmonary syndrome in Chile. Hantavirus cardiopulmonary syndrome is a zoonosis caused in Chile by the Andes virus, and it is not a specific therapy. Hantavirus cardiopulmonary syndrome is characterized by pulmonary capillary leakage and alveolar flooding, results in a high mortality rate due to fulminant hypoxemic respiratory failure and or cardiogenic shock. The information in the United States, you can see the report case of the hantavirus pulmonary syndrome in the United States, the 1993, 2021. The total case is 817 case. That is 35%, very hard, and age is 39 years. This information in Chile, the report case of hantavirus pulmonary syndrome, and 1997 to 2021. The total case is 1,282 case, and that is 33%, very hard mortality. Raúl Riquelme published and classified the hantavirus infection in 3 degrees. The grade 3 is a severe disease when patient required mechanical ventilation or had hemodynamic instability. In this paper, Riquelme reports 58% mortality. In the United States, Worley et al. Reported retrospective study a total of 51 patients with refractory hantavirus were supported with ECMO between 1994 and 2010. The overall survival was 66%, with a predicted mortality of 100%. Since 2015, the Instituto Nacional del Tórax is the referral center for patients with presumed diagnosis of hantavirus infection and ECMO in Chile. Our 5 aims was to evaluate the impact of the ECMO on the survival of patients with hantavirus cardiopulmonary syndrome in Chile. The second objective is identify early predictor factor of the use of ECMO. We perform an observational study. All patients with clinical suspect plus rapid test of hantavirus positive were early transferred to the ICU of Institut Nacional of Tórax from January 2015 to January 2022. The patients were confirmed by serology test or PCR. The patients were transferred in ambulance and 59% and plane 40%. In the patient transfer in the plane is the south of my country. The following variables were recorded: demographic data, habit, comorbidity, onset of symptoms, clinical symptoms, laboratory exams, transference time, Apache score, SOFA score, time of mechanical ventilation, ECMO, complication during the ECMO, length of ICU stay, and 28 days mortality. The study was approved by the ethics committee of my institution. The ECMO criteria in Hantavirus, the patient with critical criteria were connected to ECMO. The cardiac index less 2.5, serum lactate concentration over 4 millimoles, ventricular fibrillation or ventricular tachycardia, refractory shock, and PaO2 VO2 radio less 8. The results, the symptoms more frequent were fever, myalgia, dyspnea. And the general characteristics of patient with hantavirus is more men. The age is 36 years. The comorbidity is 50%. Onset of symptoms 5 days, and SOFA score 7 points, and Apache score is 12.5 points. Almost 70 patient mechanical ventilation, and inotropic drug is 67%. 40% the patient required ECMO. The time, transference time from the hospital, the origin to the Instituto Nacional de Doctoras, ICU, the median is 10 hours. The time installation of ECMO in Instituto Nacional de Doctoras is 6 hours in median. The duration of the ECMO is median 143 hours. The time connected to mechanical ventilation is 10 days. The global survivors, the patient with hantavirus cardiopulmonary syndrome was 90.4%. And the critical patient and with required ECMO, the survival is 85.7%. A total 5 patients did, 3 patients required ECMO death due to multi-organic failure, and 2 patients were brain hemorrhage. And patient with not ECMO was 2 patients, one for refractory shock and other for cardiorespiratory arrest. One then did not accept ECMO support due to her religion. In this slide, you can see the analyze, univariate analyze, but the risk factor to use ECMO. The most significant variable was SOFA, Apache, shock refractory, inotropic drug is most significant. Multivariate analyze, SOFA score over 8 points, and admission ICU is an independent risk factor to the predictor for ECMO support. Autoradio, the 1.5 points, 63% the sensitivity and 90 specificity. Complication in the ECMO support is acute kidney insufficiency and dialysis, 57%. Ventilate associated pneumonia is the same. Pericannula bleeding is 38%, and ischemia of the lower extremity is 24%, and 2 patients required a lung amputation. Conclusion, this presentation is early management of patients with hantavirus at National Reference Center for ECMO, and early ECMO support significantly decreased mortality. SOFA score over 8 at admission is predictor for ECMO support. This is a thing ECMO, it's pneumology, pulmonary surgery, perfusion, anesthesia. It's a multi-team, the ECMO for performer. Thank you very much for your attention.
Okay. Then, and the experience with ECMO in Santiago, Chile, any comments or questions for Francisco regarding?
Yeah, in the CESAR trial in the UK, about half the patients, I think, who were referred to the referral center did not receive ECMO, but actually got better with conventional care. What was your experience?
Cuando reciben pacientes que no tienen ECMO, andan bien. Llegan a tu centro, los que no tienen ECMO, andan bien.
Yes, in this light, the patient with no ECMO, but I see the patient in the ICU. They developed the required ECMO is a short time, and I not a predictor for developed to ECMO, but it's patient with not required ECMO is increase survival.
No ECMO increase survival. Any other general comments? Yes.
Oh, I have a question. one of the problems was the amputation of the limb. This is due to the, yes, but this is due to the ECMO venous and arterial. It can be used venous, or you cannot use that.
Not, but this patient had cardiac compromise and hemodynamic compromise. But in this case, it's veno-arterial.
But always use venous arterial? No. Sometimes use venous.
¿Puede usar veno-veno o siempre es veno-arterial?
Es veno-arterial.
Yeah.
Start veno-arterial. And the follow is
You change to venous.
Yes.
No, okay.
The change.
Okay, thank you very much.